Welcome to the Colorectal Surgeon. I am Dr. Samrat Jankar. Today we are going to talk on the surgery in fissure in ano. You are knowing about a fissure, why the fissure happens, how medical treatment done in fissure, all the related video. If you are not seen prior, you can just see in the description, links are there so that you will get very well knowledge about the fissure. Today we are talking about the fissure surgery. In fissure, surgery is the best option, but friends, it is the last resort. If you have done adequate medical treatment, in spite of 1 or 2 month proper medical treatment, your fissure is coming again and again. It is giving too much of pain, trouble, it is not bearable, and also your quality of life is poor. In those subset of patient only, surgery is recommended, and it is the only last resort for treating your fissure. Result of surgery are extraordinary and very good. The most commonly done fissure surgery is lateral internal sphincterotomy, lateral anal internal sphincterotomy. This is surgery where on right or left side the internal sphincter will be divided partially, as good as a length of fissure or more than that will be divided, so that the sphincter spasm, sphincter tightness will be released. If sphincter pressure is released, then the blood supply for your fissure will be good. As blood supply for the fissure is good, the healing of fissure will happen and you will get completely cured by fissure. So that is the lateral internal sphincterotomy, LI surgery, lateral internal sphincterotomy. This surgery should be done in qualified colorectal surgeon to get a desired result. Although surgery is known for the best of it, for its healing and success, but it is also associated with few of the problem. There is possibility that in spite of surgery, the fissure may occur, chances are very less. And also in fissure surgery, there is a risk of incontinence, has been documented in the research papers and other thing. It is known. If it is properly selected patient, done under trained and qualified surgeon, the chances of incontinence are very low. In some patient, there is a mild incontinence may happen in early post-op period that may get recovered during the course of your healing, so that you will not suffer with that loss of control, you will not suffer. So, if few of the patients such as multiparous woman, prior vaginal multiple delivery, or the patient has the tone of the lateral sphincter is low, in those patients, internal sphincter tone is low, in those patients, the other alternative are also has been described, such as botulinum toxin. Botulinum toxin is nothing but the toxin, Botox toxin, which will be injected into the internal sphincter, which is the same botulinum which is used for the cosmetic purpose, which will be injected into the internal sphincter to relax your internal sphincter pressure. Relaxation of internal sphincter pressure temporarily for 2 to 3 months will allow the healing of fissure. Once fissure is healed, you will out of that whatever vicious cycle is going on. The success rate of botulinum toxin is also lower side, and also it also has a risk of a temporary incontinence which can be recovered after a few months when botulinum goes off. Other than botulinum toxin, there can be a option of advancement flap, endorectal advancement flap. Endorectal advancement flap are done for those patients where there is a fissure is there, but your sphincter pressure is very low. If we are having a low sphincter pressure, the sphincter dividing or Botox will not going to helpful. In those patients, we can scrape the fissure and do the advancement flap, which will be very useful and outcome are better in those patients. So friend, surgery in fissure are having very good result, should be done in a trained qualified colorectal surgeon, and it should be used as a last resort when you have failed with medical treatment and quality of life is poor. In our routine practice, we do anal manometry for fissure before surgery to know that whether your tone is higher. If tone is higher, then only surgery has a beneficial effect. If tone is not very high, in those patients, the surgical benefit of lateral internal sphincterotomy or botulinum toxin are going to be lower. If tone is very low, in those patients, if fissure is not healing, the other option of endorectal flap might be opted for the patient. So friends, let me know how you feel about this content. If you like our content, like and share our video and subscribe our channel The Colorectal Surgeon for more such video about the colorectal surgery, so that you will have more knowledge and also you can understand what's happening and what surgeons are doing, so that you will get a better outcome from that. Thank you.